I'm Loretta Bush, President and CEO for Authority Health. Today we're going to be talking about a very exciting topic, graduate medical education. Now, many of you know that medical school is 4 years, but some of you may not know that after medical school, doctors then go into what's called a residency program. And here at Authority Health, we operate the second largest teaching health center in the nation. We have rotations in internal medicine, family medicine, pediatrics, and psychiatry. And I have two people here with me today who are going to make us all so much more smarter about teaching health centers and about residency programs. I have with me Dr. Ernie Yoder, and I also have Dr. Ali Trippi. Thank you for joining me today.
Thank you.
Yes, my pleasure.
All right. So we're going to start off. Dr. Yoder, you have been in graduate medical education and residency programs for many, many years. Will you talk to us about what is a teaching health center and how it might differ for how doctors are routinely trained, or probably different from the way you were trained?
Yeah, absolutely. So, teaching health center concept places residents within the community for training. And so for example, with Authority Health, our residents are based at our sites, and they have secondary rotations for training on the inpatient side with various hospital partners. So in the typical graduate medical education program, the program is based within either a single health system or a hospital. The residents therefore spend their time in that relatively closed environment, and they are limited to the experience that they can get within that environment.
Sure.
They also tend to be hospital heavy. Part of that is because patients in the hospital are more complex and require different kinds of care, but in most of the residency programs that are health system based, residents spend 2/3 of their time in the hospital.
Wow.
In our program, we know that 95% of healthcare is delivered in the outpatient setting. And so there's a much better balance. And our residents generally spend more than 50% of their time in the ambulatory setting, but not just an ambulatory setting in an academic health center, ambulatory settings that are located within our city, within regions of the city where we are providing care. So the residents get real experience with real community physicians in a very realistic environment.
Well, see, that's very exciting. Would it be correct to say that because of the way our residency program is set up, that the physicians get a chance to see the patients in the environment that they truly live? Because we're not our usual self when we're in the hospital. Mm-hmm. But when we're going back and forth to the doctor's office, do they get a chance to see us in our totality and what makes up our health and what may be causing us to be sick as well?
So that's exactly right. And another thing that's unique about a teaching health center is that we focus on things other than just the biomedical needs of our patients. So social determinants of health, which contribute to disparities in health care as well as in health, are a very important part of what we do. And so meeting our patients in their community is really critical to understanding what their needs are.
Absolutely. Yes, and so you bring up a great point, because when you mention the social determinants of health, and when I come back to you, I really want us to highlight some of the things that's unique, like our population health program and our training around trauma-informed care.
Absolutely.
But Dr. Trippi, now I'm going to turn to you for a moment. So you actually went through our residency program, and then you chose to stay and begin working with Authority Health and teaching learners. So why don't you talk to us about that experience and around your decision to stay, and what really set our residency program apart?
Yeah, thank you. So it was in medical school when I first heard about it through Dr. Seeley.
Yes.
He mentioned that this new residency program would be starting in Detroit, and instantly I was like, how do I get in there? Because you trained at a freestanding children's hospital, amazing education, and then I got to do some of the work that I thought I would have to volunteer to do, like the service work, the focus on the different aspects of health, being in the community, and really focusing on the underserved and the most vulnerable people in Detroit. So it just kind of aligned with where what kind, like the heart of medicine that I would like to provide ever since I was a kid. And I just thought, well, after residency, I'll volunteer. But this program has a community medicine and the outpatient aspect kind of embedded into it, along with population health. I think balance was a great word. You get to take care of the sickest children at a freestanding hospital, but then also you get to spend more times in clinic, and so you learn, I think, in a very whole way, like how to help the patients get well again and how to keep them there. So I like that that's such a focus of the program.
Fantastic. And Dr. Trippi, you're a pediatrician, and so you get a chance to practice in with our partner in the Pediatric LLC with Dr. Anne Marie Ice. So tell us where that location is, and tell us a little bit about that pediatric practice.
Yes, so Dr. Ice jokes that every few years or so she's moved up about a mile north, but they're all still pretty close, like in a line. So for the past 3 years, we've been at 9 Mile and Greenfield in Southfield, just north of the Detroit border. And so, yeah, having Dr. Ice as my continuity clinic all 3 years, and now as a partner, has been so lovely, because she's been taking care of patients for about 40 years. So when we go in every single day, not a day goes by where a family doesn't ask, oh, how's Dr. Ice? Like, they ask about her like they love her. Like, she's like, oh, how's my dear friend doing?
Yes.
So
yes.
It's been a great experience, and I want to just glean all of the wisdom that I can from her so that I can put it into my own practice.
Well, Dr. Trippi, you are certainly continuing in her tradition, and I'm sure that they are asking, where's Dr. Trippi as well? Our pediatric practice is located at 23077 Greenfield, Suite 200 in Southfield. We're located in the Advanced Building. Even though it's located in Southfield, certainly the majority of the patients are Detroiters. And do you also have the phone number there for the Ice practice? Will you tell our listeners?
It's 248-281-3215. We're on the second floor, Suite 200. Right there.
In the Advanced Building, providing a full range of pediatric services. Well, now let's just get back to medical education. So I'd like both of you, I'll start with you, Dr. Yoder, to talk about what is it that medical students are looking for today in medical education?
I think that's a great question. So if you take a whole medical school like our partner, Michigan State University College of Osteopathic Medicine, with about 300 students in each class, those students are interested in everything under the sun in medicine. But our focus, which has to do with our mission, is really upon identifying students that want to take care of vulnerable populations, particularly in an urban area, and that's us in Detroit. And so we're looking for the students that have a bent toward primary care, and all of our residencies are considered primary care, and who really feel a kinship with and a desire to take care of the population of patients that we see here in Detroit, and in particular in our neighborhood.
You have anything you want to add to that, Dr. Tripp?
Yeah, I think that's what I've noticed in interviewing any candidates that are interested in the program. A lot of that mentioned that primary care, the desire to serve those who are very vulnerable. I think that's fine. Right.
And we've structured our process in creating a pipeline of students and in attracting them here so that students are looking for a mission for which they are aligned, their personal mission.
Absolutely. And when you talk about having a program here, so the thing that I was amazed about was that every year we graduate about 21 residents, but then we get over 3,000 applications for people who want to come into our residency program. Talk about some of the things that you think sets us apart, and why are we such a well sought after medical residency program?
So I think our mission and vision, our commitment to our community being filled with people that are living a healthy lifestyle, and we are supporting the community to help the members of the community achieve the best state of health that they can. And I think that the students from Michigan State, who, by the way, as medical students do rotate with us, they see what we're doing in the community, and the ones that are really interested in this kind of a practice are attracted into applying. And we continue to interview a large number of students from Michigan State, and because of our commitment to the city, the county, and the region, it's attracting, I think, the right population of medical students to become our residents.
Definitely. And from my own experience, I can only speak to the pediatric program, but Authority Health hires program directors that are very supportive. Dr. Pittman Hunt is amazing. She's like my idol, and she just makes you feel empowered to do new things as a resident. Mm-hmm. Whereas I feel like in some programs, it may be a little easier to get lost in the crowd or be so, you work just so much. But Dr. Hunt, when she hears interests that residents have, she just makes it happen. Like international rotations or whatever her interests are. My interest was community medicine. She helped create that position. So it's just nice to feel so supportive. It just kind of inspires you to help out people more.
Very good, very good. And I know, Dr. Trippi, that there at the pediatric practice that you have had, some specific focus on at least 3 very targeted populations. Mm-hmm. And these are populations that are very much underserved. One mm-hmm. is the deaf and hard of hearing community. Will you talk a little bit about that?
Yeah.
I'm sure our listeners want to know that there is a place where they can bring their children and adolescents that had a special desire mm-hmm. to see kids and young people who are deaf, hard of hearing community, or the parents if they're deaf and hard.
Yes, yeah, definitely. So we probably have more parents right now. It seems that are deaf than patients, but that is very close to my heart. My oldest brother is deaf, and just kind of seeing how much my parents had to advocate for him to have equal healthcare, equal everything, equal education. Mm-hmm. The deaf community is a small but very strong, very resilient community. And so it's just kind of a blessing. Some people grow up learning Spanish from relatives. I got to grow up learning sign language from relatives. And so I'd love to be able to offer that in a medical space where it can be really challenging to otherwise need an interpreter, which is something that sometimes can compromise care, especially for your older teen patients who want to talk about sensitive things.
Absolutely.
So, yeah, we want to provide that for sure.
We're very fortunate that you bring that to our pediatric practice. Mm-hmm. I'm Loretta Bush, and I'm with Authority Health, and we are actually sitting here in one of our other locations, our Pop-Off Family Health Center, and this is where we have our family medicine practice. And we are located here at 10809 Mac, and the phone number is 313-824-1000. And here's the good news. In both of our medical practices, we accept all insurances, we accept walk-ins, and we make same-day appointments. We really want to be more than just another medical practice. We want to be a good neighbor and a good partner in the community. And we do that because we have an amazing graduate medical education teaching health center. And so I would like to talk a little bit about our population health curriculum and what we're doing with trauma-informed care, and again, what sets our training apart.
So with regards to population health, it is critical that we do not graduate another generation of physicians that believe that the practice of medicine resides only within the 4 walls of a practice.
Absolutely.
The practices exist within a community, and it is critical that the physicians that are providing care, usually with other providers, advanced practice providers, are members of the community as well. And so when one thinks about the situation that many of our patients live in, being engaged with the community, understanding the community, helps us to know the factors that our patients face that affect their health at least as much as biomedical conditions. Things like transportation, being able to get to the physician's office, mm-hmm. income, having to make choices about, do I put food on the table or buy my medication, that sort of thing. Mm-hmm. The stresses, the toxic stress that can exist in the environment and so on. Those are things that physicians and their teams must be attentive to in the community, Because if patients are distracted by needs like, do I have a safe house? Do I have access to clean water? Is my power going to be shut off? How can they think about doing the things that they need to do, the daily exercise to keep their blood pressure under control and so on?
Right.
Very difficult to handle those.
Yeah, yeah. You know, and it's just amazing to be able to talk to two practicing physicians who understand that it's more than just, people are more than just their medical condition, more than just their disease if they have one, but trying to understand the environment and how that works to keep us healthy, or how that works to cause it to be more difficult for us to be healthy, and to be able to bring that into our training practice, and then also to be able to bring it into our clinical practice.
Absolutely.
Is very, very exciting.
Yeah.
Allie, talk a little about Dr. Trippy.
Oh,
Talk
that's
a little
okay.
bit about
Yeah.
talk a little bit about how you're seeing that play out in our pediatric practice.
Yeah, so I have the lucky position to work at the Pediatric Clinic and then help oversee the clinical component of our community medicine rotation that all the pediatric and family medicine residents do. And some different ways that we've been able to incorporate the aspects of population health, trauma-informed care, and meeting people where they're at basically, is learning a lot about behavioral health resources. That seems a lot of the crux of it, because I've had a few attendings say like the medical part is kind of easy compared to the social aspects, the upstream factors of health. And so it's helpful, it's very empowering to give patients more resources for that, and especially since I've been able to work in these environments at different clinics in the city, I can really refer them confidently. I know the process, I know what the intake is for the crisis center. And so just that's hopefully ways that I can help patients who are going through terrible things sometimes, like help them be a little bit more at ease, and just knowing that even though it seems chaotic, there is a process in place for you to feel better. You probably can't even imagine that right now.
Exactly.
And at both of our practices, we're working to create relationships with community resources and agencies so that we know each other, we know how to help patients navigate and get their needs met. And it's been very rewarding to see patients get hooked up with the different agencies that can assure that they have timely transportation to make their appointments, that can help them when they have housing insecurity, that sort of thing, and in particular nutrition. We've done some really good work with assuring that our patients have access to nutritious food.
I love this conversation. I don't know, did either of you ever think that we would be talking about medical training and the practice of medicine that says it goes beyond the four walls, and that we have to have relationships and partnerships with people who provide food or transportation, or know how you can get diapers, or all of these kinds of things.
Right.
What an amazing time it is, right?
Yeah. Yes.
It is.
Yeah, and I think that if we're going to get the outcomes that we all want, and I'm talking about outcomes, not just throughput, the number of patients that we lay hands on, but the actual outcomes, the number of patients who get well, who stay well, who get their blood pressure under control, who control their diabetes, or, for God's sake, never get diabetes.
Right.
How exciting is that going to be? And I think it's because of providers like you, and because of the teaching health centers, that we're going to be able to see more of that and have a bright future.
I agree.
Absolutely. So, with that said, there's always things that could possibly stand in the way. And teaching health centers are funded at the federal level, and that funding has to be reappropriated every 1 or 2 years. And this is my opportunity to say to all of you who are listening, it's a great time for you to talk with your Congress people and say, teaching health centers are really important. There is a primary care doctor shortage, and can you imagine not being able to access a primary care doctor? Many of you right now may not only be able to imagine it, you may be actually experiencing it. So it's a great time. Reach out to your Congress people. Let them know how important it is that they continue continue to fund the teaching health centers because these are some of the brightest minds who are committed to practicing in some of the most vulnerable populations. It may not be the most highest paying of the medical fields, but it certainly is one that's mission driven and brings a lot of satisfaction to those who want to go into it. And it's also going to get us to the outcomes that we desire. All right, well, there you have it. I'm Loretta Bush, President and CEO of Authority Health. Knowledge is power. We look to see you at our Pop-Off Family Health Center or at our pediatric practice located in the Advanced Building on Greenfield. See you soon.